Well, he may need no introduction, but he's going to get one anyway. So most of us know Joe Ogle. He's a graduate of the physical therapy program at the University of Oklahoma Health Sciences Center. We won't mention which university that's associated with. He has spent his entire career working in outpatient orthopedic rehabilitation. And did I hit a key? Okay, I'm sorry. Medical settings joining Ortho Oklahoma in physical therapy. Ogle is a certified athletic trainer. He currently serves in the capacity of director for Ortho Oklahoma. It's a department, of course, of Stillwater Medical Center, as we all know. In addition to his leadership role in Ortho Oklahoma, he serves as director of physician recruitment for Stillwater Medical. I bet a lot of us didn't know that. He is a member of the National Athletic Trainers Association and AAOE, which I don't know, Joe, what that means. What is AAOE?
It's the American Association of Orthopedic Executives.
Okay. He's active at his church, serving as an MC for many special programs, and leading mission efforts with OneWorld Health in Uganda, which he is going to tell us about today. Joe lives in Stillwater with his wife and has 2 grown sons, 2 wonderful daughters-in-law, and 1 granddaughter. He's going to talk to us today on OneWorld Health and healthcare in Uganda. So would you please join me in welcoming Joe Ogle.
Thank you, Larry. That was pretty good. I know. He left the good parts out. I'm only half surprised that I didn't get a rotary clap when I came up today. So most of y'all know, maybe not everybody does, that I've been a member of this club for over 20 years. I became a member of this club when we met at Stillwater Country Club. So it's been a minute, and always consider it a privilege to not only attend this club, but obviously to have the opportunity to present to you guys today something that's I really feel passionate about, something that I love to do, you know, I'm just grateful for this club. I'm grateful for all of you all and the support you've given me and my family over the years through trials and tribulations, high times, low times. We've grown up and grown old together, and so I have a lot of value in that. And obviously, I enjoy probably more than my fair share to have a laugh at some of your expense, and maybe we'll even do that today. So, but here today to talk about OneWorld Health. Many of you know that I travel fairly frequently to the country of Uganda, which is in East Africa, Southeast Africa. The border countries for Uganda are places like Tanzania and Kenya and the Congo and Rwanda. Lake Victoria, which is the source of the Nile, is the southern border of Uganda. So, what's that? Well, if you should have consulted me on your trivia questions, Tim. So, yeah. Uganda is about the size, it's a little bigger than Oklahoma. It's about the size of the state of Oregon, whereas Oklahoma has about 4 million residents. Uganda has almost 50 million residents. So it is a very dense population. It has the second highest birth rate on earth. The average Ugandan woman delivers 6 live babies in her lifetime. Just a little perspective there. But I started going to Uganda with OneWorld Health, a company, non-government organization, non-profit organization based out of Charleston, South Carolina. My first trip was in 2014. I went twice last year. I'm scheduled to go again in July of this year. I think this will be my 8th or 9th trip to Uganda with OneWorld Health. So I want to spend a little bit of time today telling you about OneWorld Health as an organization, and then also the back half of the talk will be a little bit of show and tell from the last trip or two that I've been. So Here in the United States, we have one doctor for about every 350 to 400 people. So that's the ratio of physicians to the population in the U.S. In Uganda, they have one doctor for every 25,000 people. So there are scarce numbers of doctors with a very high population. To further make that a crisis in their country, about 70% of the doctors live in the urban areas. Kampala, Entebbe, Gulu, Jinja, places like that. About 70% of the population don't live in Kampala and Entebbe and Jinja and Gulu. So the doctors are not necessarily where the people are. So ailments that we may or may not miss a day or two from work or school can be major health crises for people in Uganda. Things like intestinal parasites, things like diarrhea, things that we don't deal with, like malaria, are major health concerns in not only Uganda, but in that part of the world. So there is a health crisis in developing countries, in this case, in this example, Uganda. There is nationalized health care in Uganda. So in theory, there is free health care available to the people there. The problem is that is a tiered system. In most of the rural communities, there is a volunteer manned health clinic, which is really about education. They have some very limited amount of treatments that they can do, maybe some Tylenol, maybe some ibuprofen. They're not manned or housed by nurses or providers or doctors. There are different tiers and they can be escalated up. The problem with that is that there's very long wait times. Those clinics are very overcrowded. Oftentimes they're ill-equipped to handle the medical situations that exist in those areas. They're very overcrowded. And so while in theory there is healthcare available to all, in reality healthcare is not readily available. There are some private clinics in Uganda as well, some non-government organizations, some private organizations. OneWorld Health is actually an example of a private clinic. In general, those clinics do provide a higher level of care, a higher quality of care, but they're not affordable for the vast majority of the people in Uganda, and they're inaccessible because they too are in highly populated areas as well. So the average Ugandan, the equivalent in US dollars, the average Ugandan earns somewhere between $1 and $5 per day in whatever their vocation is. And so there is an economy that exists that is preventive in access for healthcare for a lot of people as well. So the mission statement for OneWorld Health, the group out of Charleston, is to provide quality, affordable healthcare to communities in need, and oftentimes to people in communities that are in very desperate and dire situations. This is the values of OneWorld Health. These are all based on various Bible verses. The values of service, humility, integrity, empowerment, love, and dignity. And you can see the verses that go toward and support the values of OneWorld Health. OneWorld Health provides really a remarkable scope of services. The location that we travel to is in the Western District of Uganda. It's in a community called Masindi. Masindi is about 80,000 people, but it is a regional hub, a regional center for commerce. People travel from many miles away to come to Masindi for resources and work and to see the doctor and things like that. And so the hospital that OneWorld Health has built in Masindi really provides an excellent array of services. There is an outpatient clinic, lab services, diagnostic services, including x-ray and ultrasound. There's a labor and delivery ward. There is a NICU, a neonatal ICU ward, men's inpatient, women's inpatient. There's a surgical theater there at the facility as well. So there is very much a wide spectrum of healthcare amenities that are offered at Masindi Katara Hospital that otherwise might not be available for many people. The approach for OneWorld Health is to build and operate. It's really a hub and spoke model. For example, in Uganda, Masindi Katara Hospital is the hub, and then there are clinics anywhere from 30 minutes to 2 hours away that are day clinics, doctor's offices, a provider in Uganda that's really the equivalent of a nurse practitioner or a physician assistant is called a clinical officer. And so there may be a clinical officer in the OneWorld Health clinics that triage, treat people within their capacity, and if anything needs to be elevated or escalated to more intensive treatment, then arrangements are made for those people to be transported to Masindi Katara Hospital. This is a private organization, so there is a fee for service for the care that's given. I mentioned that the average income for a Ugandan is between $1 and $5 per day. It's $2 to see the doctor at Masindi Katara Hospital. Now, if there are x-ray services or medications are dispensed or an inpatient stay, there's additional expenses for that. I'll show a picture a little later of a young family that I've come to know and love over the years, and each time I go they come to see me, and the last time both mom and daughter needed to see the doctor, and they saw the doctor, and they received some treatment and some medications, and so for the two of them to see the doctor, it was and to get all their treatment, it was about $12 or $15. So in our vernacular, that seems like next to nothing, but in Uganda, that's a week's pay, or could be a week's pay. So again, the perspective of the economy. But the facilities are fee-for-service. They're designed to be self-sustaining operationally within about 2 years of when they are built and opened. They're typically built by contributions and funds that are raised here in the United States. So the facility, the structure, the technology, and then the ongoing operation is designed to be self-sustaining and funded through the services that they provide. As of now, OneWorld Health has served about 1 million patients worldwide, about 550,000 in Uganda, and about 450,000 in Central America, which includes Nicaragua, Honduras, and Costa Rica. OneWorld Health was really the idea of it came from an emergency room physician in Charleston at Medical University of South Carolina. His name is Ed O'Brien, and somebody that had worked in the nonprofit sector for some time. His name is Matt Alexander. This was in the mid-2000s. They were surfing buddies, as it were, and so after having some coffee after a morning surfing, they hatched this idea in the mid-2000s. The first outreach trip to Uganda was in 2009, and then Masindi Katara Medical Center, now hospital, there's a designation between medical center and hospital based on the services that are provided, but that was opened in 2011. In 2013, Masindi Katara reached operational break-even. In 2014, the first clinic in Nicaragua in El Viejo was opened. In 2020, mainly due to the pandemic, which those communities and those countries were affected as well, they launched a telemedicine option for patients. And in Uganda, you'd think, well, you know, there's so much poverty and there's so much that they don't have, but they all have cell phones. So, or almost all of them have cell phones. They're pretty ubiquitous all over the world. And so telehealth started in 2020, and then in 2021 in Honduras, Siguatepeque, the first clinic in Honduras opened, and then at the end of last year. In fact, it was announced while I was on my last trip in December to Uganda, the 1 millionth patient was seen worldwide. And so there was a big celebration that, that came with that. Part of the model for the facilities, the clinics and the hospital in country are to utilize as many national providers, nurses, physicians, staff as possible. Over 90% of the staff at these facilities, in this case, are Ugandan nationals. So not only is a healthcare need being met, but an economic need is being met in the communities in which they serve. So very much an economic driver for communities like, just like in Stillwater, how our healthcare services are a big economic driver. In a place like Masindi, Uganda, healthcare services are a large economic driver as well. So we go on these short-term trips. Our trips are usually 10 days, and this is an itinerary, an example of what our trips look like. Our mission as short-term workers are to go out into the rural communities, the outlying communities, and conduct clinics, conduct first aid and triage clinics to meet the immediate healthcare needs of the people that live in those communities. But even more than that, to let them know that there are high-quality, affordable healthcare options that are available to them. So a big part of our job, for lack of a better term, is marketing and promoting the hospital to let people know you have high blood pressure. We're going to give you medicine today to lower your blood pressure. In 30 days, when you take the last of the medicine, your blood pressure is going to go back up. And when it does, you need to go see the doctor or the clinical officer at Masindi Katara and get on a long-term health plan. Part of our trips involve a lot of community health outreach, which involves educating the people. So there will be a long line. I'll have some pictures here in just a little bit. There will be a long line of patients that wait. And as they wait, there are Ugandan nationals with a PA, speaker and microphone, that go over healthcare, health-related outreach topics. Anything from proper nutrition and drinking clean water and washing with soap after using the restroom. You know, things that we all, it's second nature to us. It's not always second nature in a place like rural Western Uganda. So here's a video, a little bit from our last trip. This was a family trip which involved some kids, which was a lot of fun. They had a good experience and a cultural experience. As you watch the video, watch for the girl with the tumor on her face, because we'll talk about her after the video.
My name's Chess Riley, and I've been connected with OneWorld Health for 6 years. The work that's being done here, I'd describe it in a couple ways. One, it's critical work that is being done. I think the level of service and the importance of the healthcare that's being provided is extremely important. The patients line up to 24 hours in advance of when we actually see them. And sometimes they spend the night and travel several hours just to get here. And I think that just speaks to how important these services are that are being provided. We decided to bring the kids for a couple reasons. One, we wanted to open up their eyes to a different way of life, and both from a socioeconomic perspective, but also from a diversity.
Short-term mission trips for families is just an unbelievable experience. To be able to bring your kids and expose them to other cultures, other worlds, other ways of life is rewarding for everyone involved.
We definitely will be taking more from this experience than we put in. I think the love in Uganda is very apparent. It's kind of everywhere you look.
All right, very joyful people are the Ugandans. Did you see her? Did you see Annette? So this is Annette. Annette is 14 years old, and the picture on your left is from July of last year when we saw her. Our driver, who I've gotten to know and love over the years, he's been with us since my very first trip in 2014. We were driving down the road. Driving down a dirt road, and Annette's walking on the side of the road, and he said, I know her, let me stop and check on her. And he said that she's had a tumor on her face for some time, but it had grown significantly since he had last seen her, which had been a few months' time. And so she was evaluated, examined, she was taken to Masindi Katara, diagnostic imaging was conducted on her, and she was referred. She had, obviously, a problem this significant was beyond the scope of what we were able to address at Masindi Katara Hospital, but she was referred to another facility in Gulu called Lacour, which is a Canadian hospital, and there was a ear, nose, and throat physician there that was able to perform surgery on her. The picture on your right is 1 month later, only 1 month later. And so an amazing change in her appearance and her life. She had stopped going to school. She had stopped going to community activities because of the kids were making fun of her and were really making her life really difficult. And so that's her house. The little building is where she lives, and those are her parents. And my favorite part of the picture on the right is Dad. We all love our kids, right? We all love our kids. We just want what's the best for them. So anyway, sorry about that. This is a divine appointment. The girl in the pink is Mom. She is also 14 years old. And the lady in the black shirt is grandmother. I don't know how a grandmother is. I'd be surprised if she's much older than 30 or 32 or 34 years old. And then baby there, she came to our clinic in a community called Nyantonzi, which, by the way, there is an epilepsy clinic in Nyantonzi at the church that we go to that is funded by the Rotary District in Pennsylvania. So there's a water tower there with a Rotary emblem on it. So that's kind of neat. So anyway, this young lady comes and says this baby was born the night before, and he's got a high fever, and he's lethargic, and can you take a look? And so the reason I said this was a divine appointment is because on this trip we happened to have with us a pediatric intensivist. And a pediatric intensivist is an ICU doctor for kids. And so she examined the baby. The baby had 104 temperature. The pulse ox, they put it on your finger. They want to know what your oxygen saturation is. In a baby, you put it on their foot, and that's how you determine their pulse ox. Anything less than 90 is dangerous. The baby's pulse ox was in the 60s. And so Nyantonzi is about an hour and a half outside of Masindi. And our doctor said this baby's, obviously, the oxygen saturation is very low. It's very dangerous. If we don't get this baby some oxygen within the hour, he will die. He will die. And so, is there a clinic in town? No. Is there a clinic nearby that has oxygen available? No. So, baby loads up in the car, in the Land Cruiser. One of our nurse practitioners, mom, baby, grandma, driver, jump in the car, scream through the sugar plantations and the back roads in western Uganda, arrive to the Masindi Katara Hospital. The baby goes into the NICU, the neonatal ICU, to begin treatment. The NICU had opened 1 week before this. So it was brand new. This is one of the very first patients that they treated. And this picture is from, again, about a month after our trip. This is from mid-August. So don't know the name of the baby, don't know the name of the mom, but when I said it was a divine appointment, a lot of things came together that are, in my opinion, this side of heaven when there was a divine intervention. So people like me stick out in Uganda. So I'll go back. So yeah, kids have fun with that. I mentioned, you might remember, we met this young lady about, she was 11 years old at the time. I think that was in 2016. She's 19 now. This young lady's name is Jacqueline. Jacqueline was born without a sternum, and so her heart was on the outside of her rib cage, just a small layer of skin. If you've been in this club for more than a few years, you've heard this story before. Jacqueline, money was raised. A lot of money was raised in this club, and she came to the United States. She came to Memphis. She came to Le Bonheur Children's Hospital in Memphis and had surgery to repair her sternal defect. And I see her each time I go. This is Jacqueline and her mom, Molly. And Jacqueline wants to be a doctor. So hopefully we'll see her working at one of these OneWorld Health facilities someday. Beautiful young woman. This is from our December trip, physical therapy. This is how I originally started going on this trip, was working as a physical therapist, and that really is the remarkable things happen in these daily clinics, in these outreach clinics with the physical therapy team. The ladies in this picture are all physical therapists from Florida. This is from our December trip. In the back there is Steve Carpenter, which most of you know, and this gentleman had spinal surgery about 20 years prior and had never regained the function of his legs. And so was completely incapacitated, unable to walk, unable to use crutches or a walker or anything like that, completely unable to move himself from one place to another, relied on other people to pick him up and carry him. We carried him into the therapy room. This is an older, repurposed wheelchair that we had and were able to give to him, and so just providing him a little bit of independence to be able to get around his house and his village and his community. No. So we were able to provide him the wheelchair, and hopefully that provided him a little bit of independence. I mentioned that community health outreach is a big part of our trip. This is a picture. That's the bus that we travel in. People line up. There may be 300, 400, 500 people lined up waiting for us. They know we're coming. They line up 24 hours in advance. They come from miles away and travel hours to get to our clinic. And so sometimes we're not able to see everybody that's in line. So a rule of thumb for our team, for the Americans, for safety, is to be back at the hotel by dark. And so to be back at the hotel by dark, this is way out in the bush. It was rainy season. There were a couple of times that on the way out, like, okay, everybody off the bus and walk for the next 400 yards because we're not sure if the bus is going to make it, and we don't want the bus to turn over with a bunch of people in it. So we were way out in the bush. And usually the further away from urban areas, then the more striking and more significant the health concerns are. And so part of our program is, even if they don't see the doctor, even if we're not able to see everybody, patients are screened. You'll see that they're checking temperatures on the kids. Anybody that had a high temperature, we were able to triage them up and get them seen. Each person would receive albendazole, each person would receive vitamin A, and each person would receive zinc. And just those simple medications, albendazole's, I don't know, 5 cents a tablet or something like that. Zinc and vitamin A are nutrients that we just get in our diets. They don't get in there. So the public health benefit from those things, albendazole is used to treat intestinal parasites, for example, hookworms. Vitamin A deficiency in children is a developing world health crisis. Supplementation in children between the ages of 6 months and 5 years, just 2 times a year, of vitamin A reduces mortality in children affected by vitamin A deficiency by anywhere from 12 to 24%. So a very simple treatment that can have very profound impact on children. And then zinc deficiency plays a role in the risk of infection as well as diminished immunity. And so providing zinc supplementation can reduce mortality and morbidity with very common issues like diarrhea and malaria. So it's a very simple treatment, a very simple fix for a major health problem. This is what joy looks like for a 5-year-old baby to take his first, 5-year-old child to take his first steps. So I mentioned that the magic really happens in our physical therapy area. You can see 2 recycled ankle braces there called AFOs. You can see a knee brace there to provide some stability, and you can see a walking frame. And so here's a picture of a 5-year-old taking his first steps. He kept saying, "Take my picture, take my picture, take my picture." So yeah. Life-changing. These trips are life-changing. You know, that's a great question. It's difficult. We go to these communities. I don't want to say that we go once and never go back. I might go back to this community. It depends on when the next trip is. And there is physical therapy services that are offered at Masindi Katara. So if he has the ability to get to MKH, whether that's once a week or once a month, there are professionals there, Ugandan nationals, that can help and continue to work with him. So hopefully so. Hopefully so. On our last day, we work really hard for 5 days. On Saturday, we go up to a national park called Murchison Falls National Park and take a game drive safari. And so these are all photos that were taken on my iPhone. These aren't high telescope, telescoping lenses from 300 yards away. This is, they're as close as they look. So the lion wasn't super excited about us waking her up from her nap, but she stayed up in the tree, which we were grateful for. And then obviously the elephant and the giraffe. Yeah. So here's a picture of Shane Harlan. So you knew I had to get something in there on you. Hey, did y'all hear the one about the 2 guys and a cow on a motorcycle? You heard that one? That's a live cow, by the way. She was alive at the time, anyway. So can you imagine the wrestling match that ensued to get that cow tied up and up on the motorcycle? All right, Ugandan sunset. So, does anybody have any questions? Yeah.
Is the Masindi Katara hospital open all the time or just when you're there?
It's open 24/7. Yeah. 24/7. They see about 1,000 patients a week. Well, they have full-time nurses, medical officers, physicians that are on staff there year-round. So I mentioned that it's Ugandan nationals that staff. We support the work at Masindi Katara, but it is standalone and operates on its own. Yeah, Larry.
Joe, 2 questions. First of all, do they all speak English? I mean, mostly. How do you communicate? That's question number. And number 2 is, do you have to fund your own travel to get over there? Do your volunteers? How is all of that handled?
Mm-hmm. Yeah. So most of the young people speak English. English is part of the school, compulsory school education program. So most of them do speak English. The young people serve as translators at our clinic. Usually anybody that's my age or above doesn't speak English. And so there is a group of translators that help. And to your second question, yes, we fund, if you travel on this trip, then you fund your own travel. The airfare, the hotel, the meals while you're in country. There is a fee to go and volunteer on one of the short-term trips. The cost on the family trip for an adult is $3,000 plus the cost of airfare for the 10-day trip. if it's a family, then the children cost is $500 per person plus the cost of airfare. Plus the cost of airfare, yeah.
Total would be
4,500, somewhere in there. Kind of depends on the cost of the air travel.
So that's $4,500 for the one person.
For an adult, yeah.
Okay.
Yeah. Any other questions?
So I know we have quite a few that travel from Stillwater. Am I correct on that? Some physicians or PAs. Do we have regular members? I mean, regular people who go to, like, if I wanted to go, would I be useful to them?
You do not have to be a doctor. You do not have to be a medical professional to go. Just like if you go to the doctor's office today here in Stillwater, not everybody that works at the office is a doctor or a nurse. There are needs for people in support roles. We have a pharmacy, and so there are people that don't have prior experience that help support the pharmacist. There are runners that help navigate people from one place to the other. There are registration team members that help obtain height and weight and basic vital signs on patients. Yes, there have been, I would estimate, maybe 50 people in and around Stillwater have gone on this trip over the years. Yeah.
One quick question. You mentioned the birth rate is 6 children per female, roughly.
6 live births.
What
Yeah.
is the mortality rate, or what's the life expectancy in Uganda?
The life expectancy in Uganda is in the low 50s. Yep. Yep. Compared to about 70, well, for women it's close to 80. For men it's 73, 74 in the United States. Yep. Okay.
Joe,
Thank you.
very much. Appreciate it.
You bet.